Welcome to another edition of the Injury Report on ESPN Steve Politziner and Dr. John Cutler, South Florida Foot and Ankle Centers, here with us, and looking forward to another great week, John. I know a very special guest is going to join us today. We'll get to that in a moment, but how are you?
I'm doing great. And listen, I can't tell you how many people come up to me and tell me how great it is you guys are on FM now. So I want to congratulate you for that move. That really was, it's tremendous that you're able to serve so many people, because before they used to drive down to Boynton and they said, we can't get you anymore. Now they're getting you all over the world. I mean, how is it working for you guys?
It's been great. We're thrilled to give our fans who live in certain parts of the area who hadn't been able to consume us as well that the chance, so they'll never have a reason to not be listening to ESPN 106.3 FM. And it also it opens us up to possibly even more audience than were sampling us before, because on the FM side there are a lot more people listening. So incidentally, there are a lot more people that give us a chance to stop on the station, and it allows us to better serve our partners. This is a podcast that we do, but your commercial announcements air on our air, and if more people can hear them, then that's hopefully better for your results. So that's what it's all about.
And I got to tell you, Steve, I mean, there isn't a time where we don't have a day goes by where someone doesn't come into us new saying, I heard you guys on ESPN and on the FM. So it's been tremendous for my practice, and I want to thank you for that. It's really helped out.
Well, that's what it's all about, and I appreciate that. Also, really looking forward to today's guest. I know a very close friend of yours is Dr. Pasquale Montesano, and you can.
That's a hard name to say. That's tough.
As we welcome Dr. Montesano here, and I might have butchered some portion of that, but he'll clarify that. But John, you should really welcome in our guest, because I know he's a close friend and a colleague of yours.
Wow, Dr. Montesano is great. We are so fortunate to have him in our community, let alone working at our own hospitals in town and our own surgery centers. He's really a terrific spine surgeon. In this era, there's so many people who do spine surgery who really aren't trained. And not only is Dr. Montesano trained, he teaches it. He's been a professor at UC Davis. He's been all over. We were just talking before. He's at places that I didn't even know where he was at. Not only trained in spine surgery, but he's had a lot of reconstructive surgery in all parts of the body. So I can't tell you, not only are we fortunate to have him here today, Steve, but to have Dr. Montesano in our community, wow. And listen, I wanted to look at you because I remember, not too long ago, you had a really bad back injury. Why don't you go into that? Maybe the doc can help you out here.
Well, and we definitely will, and I equally am excited. And Doctor, it sounds like from your credentials and everything that we've heard about you, the community really will benefit. So I think we should first start out. What brought you down here to South Florida, and that's going to allow so many people the chance to benefit from your your technical knowledge.
Well, first off, let me thank you very much for that introduction, that warm introduction, and boy, I guess I have a lot to live up to now. So I'm just a country doctor, but what brought me down to South Florida was many things. Growing up in New York, originally, I always had my sights set on South Florida, coming down to South Florida to practice, to take advantage of all of the things that South Florida has to offer. The warm weather, the warm water, the boating, etc. But I also like to get back to Europe a lot. I'm of Italian ethnicity. I like to go to Italy a lot. I go about 3 times a year, and flying from California, where I was, the trip was almost twice as long. So,
wow.
So I like it here in South Florida for many reasons.
Good. Now let's talk about back. Spines are your specialty, and why spines for you? What's the allure of it? And I'll tell you, when you just think about, when you say spine, it is such a scary part of the body, to even think about. You have a lot more guts than a lot of us, and even a lot of most medical professionals that would be the genre, the area of expertise that you would select.
Well, I guess I came at spine from a consumer of medicine's approach rather than a provider initially. My mother was paralyzed, and I can remember going back to when I was about 5 years old, trying to do little things to care for her and to make her day-to-day life better. And I watched my father, who was a family practitioner, give outstanding care to my mother, and growing up in that household, I think I was stimulated to want to do spine.
That's amazing, John. You do the same. When you're a doctor and you see something happen to somebody, you just want to help them, and it sounds like that quality cuts across so many people. In the medical field. You'll be on an airplane and somebody will fall ill and be like, is there a doctor here? It doesn't mean that because there's a doctor there that he knows exactly what, but those doctors jump right up. I mean, it's a special fraternity that you guys are a part of.
No doubt, no doubt. And the great thing is that what we do, especially in South Florida, unfortunately, is we treat so many people who don't have insurance or have barely any insurance. But we consider ourselves fortunate that we're able to help people. I know Dr. Montesano feels that way. I know his background, and like I said, he's not only provided service for people who are insured, but for the underinsured as well. So some of the things, let's get right down to it. Let's see if we can talk about some of the things that Dr. Montesano does. And one of the questions that comes up, Dr. Montesano, is disc replacements. When to do it, who gets it, when should you do it?
And what does it mean? Does it mean you can't do,
Are we
as
talking
a rule, unilaterally run, work out?
only for old people, young people? I mean, who can get that type of procedure?
Boy, that's a complex question there, but I'll try to do it justice.
By the way, John always asks the complex questions because I'm having deja vu of the last episode and the episode before that, where he just hits his colleagues with a doozy right off the bat.
There's like 5 or 6 questions rolled in there, so. If you could imagine,
This is his payback for all of his patients asking him those questions over the years.
when you've exhausted conservative treatment, and I need to emphasize that, when you've exhausted conservative treatment and it looks like surgery is inevitable, then you've got some choices. One of the choices, kind of the long-running choice, is to have a fusion. There are instances when you may be able to have a disc replacement or a fusion. Now, not every patient that's a candidate for a fusion is a candidate for a disc replacement, and here's where some patients get themselves into trouble because they succumb to the advertisements and they want to push the envelope and get a treatment that may not be the best treatment for them. But what a disc replacement does is it allows the preservation of motion at a level that ordinarily would be fused, ordinarily would be glued together. It's recommended in a situation where the disc is broken down and is not functioning. The disc, after all, is a joint, and if that joint, just like the hip joint or the knee joint, historically, we treated those joints when they broke down by a fusion, and then starting in about 1960, a man by the name of Sir John Charnley in England developed a way that the hip, instead of being fused, could be replaced. And I don't want to say that the spine is technically a more complex joint, but I guess it is a more complex joint. It has the spinal cord around it, it has nerves around it. So it took us a lot longer to figure out how to do that. So beginning at about 10 years ago in Europe and then slowly coming to this country, people developed a way to replace the joint. And what that does is it preserves motion and allows the injured segment to be treated in a way where it doesn't have to be fused.
Now let me ask you a couple of very layman-esque questions that I think the average Joe out there would be curious about. First question, when I think about back surgery, I tend to cringe more than when I think about arthroscopic knee surgery. Yet 30, 40 years ago, arthroscopic knee surgery was, it ended Tucker Frederickson's career, first pick of the NFL draft. The example by the New York Giants in the 60s, the example has been made many times that if they had advancements in arthroscopic knee surgery, it would have been back in 2 weeks. Will we ever get there with discectomy surgery? Will it be like arthroscopic knee surgery at some point?
Well, now you've changed the treatment. We've gone from disc replacement to discectomy.
Okay, or disc replacement.
Well, I think that you've got to look at them they're two totally different treatments for two totally different problems. I think you can look at somebody like a Joe Montana, speaking about the average Joe, who's the unaverage Joe. But he was able to get back so quickly after a discectomy because of who he is inside, the hard work that he brought to the table. And spine is different than any other area. If you have appendicitis, you go in, you get your appendix out, the role of the patient is very small. You have to show up and not do anything, ridiculous after. But when you're treating your spine, you're half the treatment because you have to put a lot of rehabilitation into it. There's a lot of things that need to be addressed. And there's things, quite frankly, that in this day and age people are reluctant to address. One of the things that people are reluctant to put the effort into is getting their body weight under control.
Yeah, that's a good point. So as far as how that'll help from a recovery, standpoint and what your body, can withstand. We're talking with Dr. Pasquale Montesano here on the Injury Report. Steve Politziner, Dr. John Cutler with us as well. Also, how about genetics? What kind of role does genetics play in this as far as hereditary? If my dad had a bad back, am I more likely to have a bad back?
Probably. And when your dad has a bad back, we don't know if it's, we clearly do know, we've not worked out mathematically what your risk is, but you're clearly at higher risk. And some of the risk is genetic, and some may be some of the bad habits that he has. We know that, for instance, cigarette smoking is one of the largest leading risk factors for back and neck problems.
That's amazing. So, putting that into mind, what are there things, are we as a society doing enough from a preventative standpoint, from when they're kids to teenagers to the weekend warrior? Are we doing enough things? So, meaning, if my back doesn't hurt, are there things that I should be doing, if I have no history of back pain, to be building up my back and the strength around it to make sure you're, less likely to incur problems long term?
Well, I think that in general, our society in this country that I love dearly is becoming less and less healthy. We're becoming more and more obese. We're not eating right. You heard the president's wife, I think a year ago or so, said that obesity is the single biggest security risk that our nation faces. And we have multiple celebrities that are out there now trying to get people to be more aware of all of the detrimental effects that this has on our society. Diabetes, high blood pressure, and certainly back problems has to be way high up on the list.
And would you also put in there, and guys, John, you're very active, you work out, you're involved in a lot of things. Today's various exercises, I've had physical therapists say to me the best thing that ever happened to their business was CrossFit, because they have people coming to them all the time, and orthopedists say things like that. The amount of things from the P90X and the Insanity and the CrossFit and the boot camps that people are doing on their own, and some are doing them off of video, some are doing off trainers that allegedly have the accreditations. Is that also I don't want to call it an epidemic like obesity, but is that also a primary concern of yours?
Yes, clearly, and once again, we've asked multiple questions here, and you're hitting the nail on the head in each question. I think there are so many people that are becoming trainers by getting some certificate over the internet. I think that as an individual, if you're, you need to work out. You need to work out regularly. You need to ease into your workout. You need to get good advice before you design that program. And you can't go too, you brought up a word, insanity, you can't go too insane. I own a fitness center in California. It's been voted #1 in the United States by the American College of Sports Medicine. It's a Roosevelt Health and Wellness Center. And we've got, we're program oriented, and we ease people into those programs. And we have a lot of people that, had a problem and came to us once the problem developed. So I think it's making sense and being sensible about what you do, developing a routine, and then be religious about it.
What would be...
More specifically, though, in the course of this routine, if and I think the average person that we're talking to and talking about, we know, are those not only weekend warriors, but they're the people that work out the 3 days a week, the 4 days a week, like I know Steve does as well. I mean, what are some of the back exercises that we do? I mean, back in the old days, I remember doing leg lifts. I mean, is that the standard still? Are there other things that should be done inside of a gym that could help strengthen our lower back?
Once again, excellent questions. I think we have to keep in mind that, For a long time, we as doctors, going back to the early 1900s, we used to give people a set of exercises called the Williams flexion exercises that I think John's alluding to some degree here. And they concentrated on strengthening the abdominal muscles. And that's very, very important, but not at the expense of strengthening the back muscles. So any routine for the spine has to include both. And in fact, the back muscles actually need more attention. So it should be a 3-to-2 relationship where you work those muscles a little harder. Now, using a gym ball, I think is a great idea, where you can do extension exercises either on the floor or using a ball. And the other aspect of that is I think you have to learn how to lift properly. And I don't know that people have the attention span so that you can say, okay, this is the proper lifting technique. So what I do instead is I have them train or overtrain their quadriceps muscles, the muscle in the thigh. So once they get that strong, because it's the easiest thing to do, they then lift properly because they have strong quads.
That's interesting. Yeah, Dr. Montesano, South Florida, with us, and Dr. John Cutler, South Florida Foot and Ankle Centers, here on the injury report. That's really, that's fascinating. That's probably not something that you would definitely be able to, get on your own out there. So hopefully you're really taking this all in. We look at athletes and we watch them on TV and we see they hurt their back. I can always remember as a kid watching Larry Bird laying face down. They always said, he has a bad back, he can't sit on the bench. Explain, so why did he have to lay face down at all times to get any kind of back relief, literally laying on the floor to get any back relief? Was that just pressure on the nerve? Because you see a lot of that with people with back injuries. They can't sit traditionally, they need to lay down.
Well, a lot of this is going to be speculation on my part, but there's not one position that I can tell a patient, okay, lie in this position. Each patient is going to come to me and say, I found that lying in such and such a position was the best thing for me to do. And obviously you encourage that and you discourage the positions that are more painful. You have to realize with all of these athletes, like a Larry Bird, like a Joe Montana, with all of our special forces guys, the Navy SEAL, these guys, it's a different order of magnitude treating these guys, and they are playing with injuries that most people would be, completely disabled with, and it's because of a long history in their childhood, developing a high pain tolerance, motivation, pushing, not concentrating, not thinking about the pain they have, and so it's hard to compare somebody like people we've just mentioned to regular people, but regular people can learn from that and can apply that, and they have to realize, hey, these guys are functioning at a very high level with injuries similar to what I see my coworkers have, and they can't function. So it's something to aspire to.
Nice. Wow, they're getting a lot of good knowledge here, and I think what we should do is even get into some of these specific athlete instances. And why don't we do that? Why don't we take a quick break, and we will do that on the other side. It's the Injury Report on ESPNWestPalm.com. Welcome back to the Injury Report on ESPNWestPalm.com. Steve Politziner, Dr. John Cutler, and Dr. Pasquale Montesano here with us today, really getting quite an education, about the back from really one of the foremost spine experts in our area and beyond. And Doctor, so many people see these athletes, and I think you just put it eloquently moments ago, that we can't even compare ourselves to them because the threshold of pain, the determination, the motivation, for whatever the reason they're doing things that we can't even try to do in terms of coming back in short order and play through pain. But what we love to do is maybe educate ourselves a little bit more on what these procedures mean that they're getting, and really what they are enduring, to probably even appreciate these guys that much more. Steve Nash, multiple-time NBA MVP, has had debilitating back issues where there'll be a couple days or weeks that he can't play, and then he'll come back. He's treated those through the years with epidural shots. That's something I've received as well. Could you talk about epidural shots? Because some people say they're effective, some people say they're not. Some people needed 1, some people needed 3. Give us a little bit of epidural 101.
Well, first of all, it is a standard of care. It is a treatment that we are providing to patients. I think the response is going to be patient selection. and it's hard to determine at this point in time how to select those patients. You know, there is a treatment that's going to be on the horizon. By on the horizon, I mean probably within a year or two. It's actually going to come out of a South Florida company that started at Stanford University, and that company is called Cytonics, and it's in Jupiter, and they've come up with a way of identifying who the responders will be to an epidural steroid injection. Right now, we identify them through our clinical experience.
So will it be through blood, or?
It'll be through a washing of the, so before you have your injection, you'll have a little bit of sterile saline. By a little bit, I mean like 1 cc injected in the area where the epidural is going to be given, and then you draw up a couple of drops of that, and that's all that's needed to test for, and you'll be testing for a protein complex called the fibrinogen aggregate complex. It's sometimes called...
Don't quiz us on that. Don't quiz me on that later, okay?
And that lab also has determined the treatment, which will come from your own blood.
Wow.
And there'll be a protein in your blood that can be given. And so in the future, I think instead of steroids, we'll use that. But, I mean, for right now, I think steroids are a good approach. You can't overdo it. You know, some people say you shouldn't have more than 3 in your lifetime. Some people say more than 3 in a year. And I'm probably somewhere in the middle of those two.
That's really interesting.
Just to go on that for a second, it's pretty interesting that we've talked about on the show many a time is PRP therapy for different joints in the body. Is that applicable for the back or no?
Well, first of all, the science on PRP therapy is starting to go against it. And in fact, some people are saying that the PRP treatment is like battery acid. It actually has a negative effect and not a positive effect. And that's not my term. I've heard that term used in other discussions. But I think it's going in the right direction, that over your body naturally has natural defense systems, and we need to exploit them. We need to find out what they are in different areas. For instance, we know in rheumatoid arthritis that there's a biomarker called, it has a big name to it, it's called alpha tumor necrosis factor. It has nothing to do with tumors, but when this complex is identified, people are having a flare-up of their rheumatoid arthritis. And we know that you see the television every day of an antidote to that. And so the same is going to occur with herniated discs and with back problems, where we now know what the biomarker is, and it's the fibronectin aggregate complex, and we also know what the antidote to that is, but that's not approved yet at this time.
Wow,
Okay.
There's some exciting things down the road. I feel really silly as I'm going to go back to my basic questions here, but back spasms. You hear it all the time. Hey, that guy's missing the game tonight with back spasms. Yet you see him on the bench in street clothes. What is going on when someone's getting a back spasm? How painful, is it, and what's the treatment?
The back spasm is not the cause of the pain. It's not the cause of the problem, but the spasm is an attempt at the body to stabilize that setting, to stop the motion. So the disc is a joint. The joint is broken down, and if we force motion across that joint, it's going to have the consequences of pain. So the body, once again, naturally has a mechanism where it tries to eliminate that motion, and it goes into spasm. And yeah, the guy's walking around because he's not irritating the joint. But if he were to irritate the joint, then the spasm would go up, and he just has to allow time, which is the great healer.
That's the healer? Okay.
To just dissipate the underlying problem, which is usually going to be coming from the disc.
Much like a hangover. It's time. It isn't about
Time.
anything else.
We don't know about that.
From what I have heard. How about chiropractors, Doc? It always seems to be a hot button topic. Do they work? Are they good for you? Once you're under their care for a while, do you have to stay under their care forever? Where do you stand on the value and the correct usage of chiropractors?
You're putting me in the hot plate. So anyway, the way
You can take the fifth.
No, I'm not. I will try to come up with a...
Can you apply like the Hippocratic Oath or something? What is it?
I told you about the wellness center that I started about 15 years ago, and we had chiropractors in there from day one, still have chiropractors in there. I think they have a significant role. I think the RAND report was a report of all the available studies of chiropractic showed that a month of chiropractic treatment outperformed tincture of time, and tincture of time is a good healer. And I think it's applicable, but I think, chronic long-term chiropractic has to be used to transition the patient to another form of treatment, i.e., chiropractic, healthy habits, weight loss, exercise, core training, aerobic training. This is the path. It's the beginning of the path. Now, how does chiropractic play into, I think, this laboratory, cytonics, and finding this fibronectin aggregate complex? I think in some ways, maybe, this is speculation on my part, have shown why chiropractic is effective, because perhaps what happens during a manipulation is you dilute out the concentration of the fibronectin aggregate complex, and you get a patient to have less pain.
Wow. And I would say, lastly for me here, Doc, unless you have anything else, would be just one kind of piece of advice for the average guy out there who may be experiencing a little bit of back pain, doesn't have a history of it. What would you recommend for him, whether that's getting some, when is it time to get something looked at? Should more aggressive stretching be used, things like that?
Well, I can get myself in a lot of trouble answering that question, and obviously that question is very pertinent, but it is complex and has multiple layers to it. I have a horrible set of x-rays. I have no pain. Personally, my x-rays of my spine are horrible. When I show it to my colleagues, they can't believe them. They're beyond what. And we were talking earlier about jiu-jitsu, and I told you that I was very, very fortunate to train with an incredibly intelligent, incredibly wonderful individual by the name of Paleo Gracie before he passed away. And he talked to me about his own back and a step-off that he had, and he allowed me to examine him, and I felt the step-off, and he put my hand on my back, and we have the same kind of a step-off. And I turned to Haleo one day, and I said, it was actually October 1st, it was his birthday, and I was taking him out to dinner. And I said, Haleo, what do you recommend I do for my back? He said, you want me to take your back pain away? I said, well, I don't have a lot of back pain, but I'm feeling it, and I'm worried about what's going to happen in the years to come. Well, I got a slap, and I got told, stop having back pain. So that's not applicable treatment. It's not something a doctor can do for his patients, but I think the bottom line there was mental attitude, mental toughness, mental discipline. And I think that's first and foremost a healthy lifestyle, all the things we've been talking about, eating right, getting your weight under control, exercise, good family life. I mean, if you have good people around you, you have a more positive. I always say to my patients and my friends, my colleagues, I can make a person who views the glass as half full, I can turn that positive nature on. Somebody that views the glass as half empty, I have a very hard time with. So I think it's all of those things broken down. But if the problem is severe, if the problem is ongoing, if the problem is increasing, if there's neurologic deficits, you need to consult your physician. And you need to consult your physician with any worry, and then have your physician direct you into the appropriate program.
Steve, I just want to let you know that we've had the pleasure of listening to Dr. Montesano today, but more so than any other person we've had, I don't know if you caught it, but at the beginning we were talking about history. And we talked about the history of implants. And I was talking to Dr. Montesano prior to coming in here, and he's really a Renaissance man. I mean, I majored in history. This man knows history back to the Middle Ages, all right? But not only do we see that and the current treatments that we use for back, but he's also telling us the way the future's going to be. And the future is all our biochemical markers, genetic testing. That's where this is going, and this man's on the cutting edge of it. So I want to thank you very much for coming here today.
Yeah, so do I, and I also want to give anybody who's listening the chance to get in touch if they require any treatment. Where would be the best place for them to do that?
Well, John, what number do you guys have a number?
Yeah, I mean, basically for Dr. Montesano, you can reach him at 296, that's 561-296-1188. It's 561-296-1188. And you can request to see a consult for Dr. Montesano. And I'm telling you, this is the guy, to go to. I told you,
You can visit me on the web at www.spinedocs, spinedocs.org. spinedocs.org.
All right, great place to learn more about you. I I'm not rooting for another back injury, but I know who I'm going to go see when if that were to ever occur. Dr. Montesano, extremely educational for us, and I'm sure everyone who's listening, and we look forward to hearing more about some of the advancements that are coming down the road, and hopefully talking with you here again.
Thank you very much for having me today.
John, another good one in the books.
No, it was great.
You know the best guys.
Hey,
you know the
listen.
best guys.
Listen, this is the guys that I go to, so it's very easy for me. I just look at my phone book and say, which guy am I, what doctor did I see last week? That's what I'm going to.
Yeah, remember the name Montesano. A back and spine is not something you want to mess around with. And if you didn't learn enough about it today, then I think you should want to make sure you get some more time with Dr. Montesano. So thank you so much. It's been really educational, and we hope you enjoyed it, everybody, today who had the chance to listen. This has been the Injury Report at ESPNWestPalm.com.